everyone. Now we're going to talk about chapter 12, which is our anti-cancer drugs. Now, with this chapter, I don't expect you to know the names of a lot of the stuff that we're going to be talking about because unless you're actually dealing with cancer patients, the majority of the time, a lot of those things aren't going to come about. And a lot of times we will, as an LPN, you will give cancer drugs. You'll give the oral dose. Usually with the IV ones, those has to be given by a trained individual. But you can look at all the cancer chemotherapy drugs, and that actually starts on page 196 you can look at. And like I said, we did the different type of, ones, they work on the body differently. But we're going to do a basic thing about anti-cancer drugs, chemotherapy and things like that, and just the basics. But like I said, these are kind of some of the basic rules that we're going to talk about and some things that we are going to be looking for. Okay, so cancer. Cancer is not a good thing, duh. It is an uncontrolled, it's cellular growth. It can cause local tissue invasion. It can cause distant metastasis. It is a group of once normal tissues that just mutated and became abnormal. And it caused cells to mutate. And a lot of times you will lose the ability to perform the specific functions that you're born with for that area. Then it can start invading other tissues around it or even distant to it. So usually you have the site of the origin, and then it's called the growth, or which is metastasis. So sometimes you'll hear a patient goes, they have lung cancer that metastasized to the bone, or they had brain cancer that metastasis to the lung, something like that. So there's the original site of it, and then when it starts spreading, it metastasizes, it goes to different areas. So that's what the metastasis is. So there's an origin and then metastasis. So treatment for cancer, you can do surgery, you can try to remove the area. Radiation, a lot of times they will use it to shrink things, to make them smaller. Sometimes that will take it away completely, or sometimes they will shrink it and then they will do surgery and to remove it. Chemotherapy, that's the drug therapy that they can use. There's a lot now of hormone manipulation where they can give you male or female hormone to prevent things. And then, of course, there's targeted therapy where you use one or more for treatment. Now, with chemotherapy, it's drug treatment that uses powerful chemicals to kill fast-growing cells in the body. Okay, so chemotherapy is going to kill those fast-growing cells. It is used to treat cancer, of course. They're very cytotoxic effects, so they will cause big-time cell damage and cell killing. They will destroy both cancer cells as well as normal cells. And usually, think about it, if they're killing fast-growing cells, usually the ones that are fast-growing are what? Hair, skin, intestinal tissue, and blood-forming cells. So think about people who have cancer. They lose their hair. They can have issues with their bowels. Skin starts getting bad, and their blood-forming cells, they decrease their white blood cells, red blood cells, and platelets. So it affects those. So that's what, those are fast-growing, so it affects them. That's what cancer will kill, those fast-growing cells. They are part of our high alert drugs. Remember, it's part of the pinch. C is for cancer. Of course, you need special training to give IV chemotherapy drug, and usually it's given by an RN who has had special training because you have to handle it appropriately. You have to monitor the patient very closely for any signs of adverse reactions. You need to monitor that IV site very closely because what happens is if it starts to infiltrate, you could kill the cells all around the IV site. So it is very closely monitored, these individuals, by an individual, and they have to be trained to do it. As an LPN, you will be able to give PO cancer drugs. Usually it will take 2 nurses to sign it off, and we will give those. You just have to handle them appropriately, wear the appropriate gloves when you're opening them up, and make sure that you dispose of the wrapper and things appropriately. And like I said, that's part of our pinch drug. So it's 2 signs off because we know that cancer drugs can cause harm if given inappropriately to a patient. As nurses, we are responsible to provide care and comfort to our patients before and after they get their chemotherapy. So with our chemotherapy, we want to monitor the response. We want to make sure that we take care of the side effects that occur. And that would be like making sure we medicate them for nausea. Let's give them medication. Maybe during their chemotherapy, because some of these can last over 4 hours. The infusion can last over 4 hours, so maybe give them something to help relax them beforehand. But we want to make sure um, these medications can make them nauseated, so let's give them some antiemetics so they can eat and get some nourishment. Maybe they are very anxious, anti-anxieties. Maybe we need to give them something to help them sleep because it's bothering them or through the pain. So we want to make sure that we make our cancer patients very comfortable because this is a very traumatic time for them and they're going through something very detrimental. All right, so we're going to talk about there's 6 categories of chemotherapy, and like I said, you can look at those. We have the anti-metabolites, we have the anti-tumor antibodies, we have the anti-mitotics, we have the alkylating agents, we have the topoisomerase inhibitors, and then we have miscellaneous drugs. And like I said, you can find them on 196 and 197. Our IV chemotherapy, when we deal with IV chemotherapy, you must wear gloves. You must wear protective wear. So you're going to wear special gloves. You're going to wear a special gown. Sometimes you're going to put goggles on and everything because you need to protect your skin. Patients, like I said, if you get that on your skin, it can cause tissue damage in that. So that's why we have to make sure, even if you're going in the room when they're doing the chemotherapy, that you make sure you wear appropriate protective wear. Patients, when they're getting IV chemotherapy, they can have many type of devices. They can have implanted central catheters. They can have internal or external ports to help them because they want good IV sites because a lot of times if you use a peripheral line, if that gets infiltrated, it will cause tissue damage. So a lot of them will get implants. They can get the internal metaports put in that they have to be accessed each time. They can have special ports put in the arm so they don't have to keep getting stuck because that's a lot of times that they're good when they go through their treatments. These ports will reduce the risk for extravasation. That means the leaking out around the tissue and causing tissue death to that area. But it can increase the risk for infection because anytime you have an IV site and you're opening it and keep using it, you have risk for infection. Plus, it's staying in the body. That's an issue too. Like I said, very important to pre-medicate our patients before they get their chemotherapy to help with the side effects. Before we receive chemo, we want to make sure we get a set of vital signs and always check their mental status. And you're going to find out why, but we're going to check their mental status. We're going to monitor for any signs of allergic reactions. We're looking for hives, low blood pressure, rapid and irregular pulses, swelling to the lips and lower face, that angioedema that can occur, sensation that they have a lump in the throat. If any of those things occur, then we definitely want to stop the infusion. Okay, never, do anything with the IV site, but stop the infusion and talk to a physician ASAP. We want to teach the patient, make sure they continue the treatment. We know it can have physical damage that can be temporary or permanent. We know that the bone marrow will become suppressed, so they're at risk for anemia, neutropenia, and thrombocytopenia. But the thing is, we want to make sure that they continue the treatment because it's the only thing that's going to help with the cancer. Now, remember with thrombocytopenia, the important thing is we also have to teach our patients with thrombocytopenia is that it decreases your platelets. So that puts you at risk for bleeding. So we want to make sure we teach our patients to use soft brushes when they brush their teeth and never to floss because they can actually start bleeding from their gums, and that's not a good thing. So we want to make sure we teach that. Sometimes a patient's white count may be low because we know that it causes neutropenia. But sometimes if their white count is so low, they may wait a few days or so before they will do the treatment until the count comes up. And then they will restart the chemotherapy. So sometimes they'll monitor lab work and determine, well, let's wait a couple days, let's recheck you, and if your white count comes up, then we will give you the dose of chemotherapy. So they have to work around the person too. Now, side effects in some symptoms that are very distressful is nausea and vomiting. Okay, these are side effects. Hair loss or alopecia. A lot of times people can get open sores on their mucous membranes, mucositis. And with that one, this happens when the patient becomes immunosuppressed with chemo. Patients should have prophylactic prevention drug or anti-infective drugs at the first sign of any mouth sore outbreak. So if they start getting any sores in their mouth, they need preventive treatment to help prevent that. But like I said, they probably need to get an antibacterial, anti-infective one to prevent that infection from spreading. So a lot of times you can have it and then later on it will go away. It doesn't mean you'll get it again. But if it does occur those sores, you need to say something. If you're on, they need to be taught. Make sure you report it so we can get you something to prevent it. And the big thing is change in mental status. That's why I said it's important to know what their mental status changes, because these drugs can cause a mental status change issue. So that's basically with IV chemotherapy. Now, the next thing we're going to talk about is hormone manipulation. Okay, hormone manipulation, that's on page 201. These drugs are used for hormone manipulation, of course. They control some types of cancer, and those would be like prostate, breast cancer. They don't lead to a cure, but actually they slow the cancer cells down. And a lot of times if they can slow the cancer cells down, they can do other forms of treatment to help with that. But if they can slow it from progressing and spreading, that's at least a start. So we're going to use hormone manipulation to try to stop things from progressing. Side effects, though. Because we're dealing with hormones, we're going to have a lot of male and female issues occurring. So, side effects. Androgens and anti-estrogen receptor drugs, okay, these cause masculating effects. In women, it will cause facial hair. Menstrual cycles will cease, so they will stop having periods, and their breasts will start to shrink, because these are anti-estrogen, that's a female hormone, androgen, male hormone, so you're getting a lot of more male stuff going on. And so another thing that happens when they're on that, they will retain a lot of fluid, so fluid retention. So they're going to gain weight, and that is expected. That is an expected side effect when they're on androgens and anti-estrogens. They're going to gain weight, and they're going to get masculinating effects occurring. Okay? Now, androgens given to a men or women will cause, now think of it, now we're given male things, acne, so this is for men or women, hypercalcemia, and liver dysfunction. Okay? And that's androgens only given to men or women cause those things. Now, estrogen or progesterone, now think of this, now we're talking about female hormones. When we give it to women, we're going to have very heavy, irregular periods. Okay? Fluid retention, and very much you'll have breast tenderness. Okay? Now, if we give them to the male population, estrogen or progesterone, if we give it to men or women, you're at very, very, very high risk for DVTs, okay? And it's very important that they report if they have any calf pain, swelling and redness, or cords hard cords, in the legs where it follows the vein. They need to report that ASAP. That's very important to know. They are at big time at risk for DVTs if they're taking estrogen or progesterone, men and women. Now, if they're on estrogens, progesterones, and anti-androgen receptor drugs, if we give those to men, now remember, female hormones we're giving them a lot of, they're going to have a lot of feminine effects. So they're going to have thinning of their facial hair. They're going to get smoother skin, and they're going to have change in their body fat. So guess what? They're going to develop breast, okay? And they may get a little chunkier like women do. They can develop gynecomastia, which is the breast. Their testicles and penis may actually decrease in size, and they will actually have a problem getting an erection. So think about it. It's female hormones that you're giving to a man. Okay, so that's the information about hormone manipulation that they will usually give. And like I said, usually treats prostate and breast cancer. It doesn't cure it, it's just going to prevent them from getting worse. But think about it, if you're giving more male hormones, what's going to happen? If you're giving more female hormones, what's going to happen? But like I said, when we give those masculinating thing to females, they're going to have fluid retention. That's going to be a common side effect. A lot of people say, I'm getting a little chunky. You're gaining, weight, your fluid retention. You're not going to have period's going to go away. Also, another big thing is when they're taking those estrogen and progesterone, when we give them to women, the heavy bleeding. Sometimes we may have to check a hemoglobin and hematocrit because they will bleed a lot. And then, of course, the DVT for the estrogen and progesterone. Very important to make sure we check if they have any complaints of DVT, that we tell them to report that ASAP. The last thing we're going to talk about in the cancer thing is targeted therapy. And this starts on page 203. And those are the common agents that we use. It's newer cancer treatment that uses drugs or other substances to more specifically identify and attack cancer cells. And it's usually while we're doing little damage to normal cells. So it's more targeted therapy for that person. It's going to target a certain thing. They do have side effects. They can have allergic reactions, high blood pressure, of course, nausea, vomiting, diarrhea, and there's other GI discomfort that can occur with it. Bone marrow suppression, so we know that's going to affect red blood cells, white blood cells, and platelets. They can have anorexia, so they don't want to eat a lot. The abdominal pain, bowel changes, decreased taste sensation, peripheral neuropathy. So if they have peripheral neuropathy, that's going to be a big issue with sensitivity. So people at risk for falling and getting hurt because of the peripheral neuropathy. Hyperglycemia, so we do need to check our diabetics because their blood sugars are going to be more elevated, and we would adjust, of course, their diabetes medication. We already know it suppresses the bone marrow, so at risk for anemia, neutropenia, and thrombocytopenia. It can cause headaches, back pain, muscle and joint pains, mucositis, which we know is the source in the mouth, and skin problems. So those are some issues going with that when we talk about targeted therapy, but it's more specifically targeted to certain cells, which is better than doing cancer chemotherapy, which is cancer all over. It just attacks normal as well as abnormal cells. And then, of course, our last thing we talk about is our immunotherapy, which is our biological response modifiers. This is a type of treatment that mobilizes the body's immune system to fight cancer, so it gets it going. The therapy mainly consists of stimulating the immune system to help it do its job more effectively. So we want to stimulate it so it can try to attack these cells that are not supposed to be in the body. Okay, we usually use them to treat any type of melanomas, the hairy cell leukemias, any renal cell carcinomas, ovarian cancer, as well as cutaneous T-cell lymphomas. So they are used a lot for that. Side effects would be, of course, inflammatory reactions. They can have some edema, so there can be some fluid shifts, fever, chills, rigors. They can get flu-like achiness. Again, peripheral neuropathy, safety is going to be a big problem, with that. Visual problems, hearing issues, unsteady balance and gait. Orthostatic hypotension, so we know if they do have orthostatic hypertension, we want to make sure we tell them to sit a little bit before standing. They can get some skin issues like rashes, dryness, itching, and peeling that occurs with that. So we definitely want to be concerned. Now, for the pregnant population, a big thing with this is the thalidomide will cause severe birth defects and should never, ever, ever be given if you're pregnant or planning to become pregnant. It is definitely, we want to use 2 forms of contraceptives to make sure, if they're in childbearing ages, to make sure we prevent pregnancy. So with the thalidomide, they would definitely want to make sure that they, check that and make sure you use 2 reliable forms, because that is going to cause big time severe birth defects. But the most important thing I can say also is we have to remember, report any signs of infection. Because if it does occur, they may have to delay the treatment for a little period of time just to help. So like I said, don't get too crazy over like medication names and things like that. Go more with the categories because that's what it's going to. There's not like a lot of questions on chemotherapy and anti-cancer drugs and that, but there are some questions, especially like the hormone manipulation things. Some things, like chemotherapy drugs, how it's important, like, they're pinch drugs. The importance of making sure we medicate people, making sure we wear the appropriate wear, that it kills all type of cells, especially those fast-growing. That's why people lose their hair and they have bone marrow suppression in that, because it kills those fast-growing things. We want to make sure, remember about the thrombocytopenia, importance of good oral high mouth care, not to brush hard, use soft brush, and make sure we don't floss. making sure like the white blood cell count, that if it is low, we may have to delay treatment until that white blood cell count comes up a little bit. If they get those open sores in the mouth, to make sure that they report that, because that happens when the immune system is suppressed with chemo. And then, we want to make sure they get prophylactic treatment. And if they get them, develop later on, then we will treat them again. But they should report that when it does happen. When we're talking about the hormones, the fluid retention, the risk for DVT, that's important. And then, of course, the targeted tissues, those are going to be more targeted to certain areas. And of course, the immunobiological responses that, it's going to be working on certain things, cancers, and that reporting infections. So that's basically the anti-cancer chapter. That would be chapter 12. It's a small chapter. Like I said, it's not something, go over the drugs, because unless you're going to be doing that for a living and you're going to be a cancer nurse, you're going to work in the cancer units. We're going to actually give the medication when you become an RN, because you're going to continue your education from an LPN and become an RN. Then that's when you're going to deal with that. And I give high credit to the nurses that do this, because it's very taxing and very detrimental to have to be with someone and, going through something very hard, and you have to spend like hours and hours with them. And you can see how miserable some people are, how taxing it can be. And that can work on people. So it takes a very special individual to work with cancer individuals. So I'm going to end it with that. Any questions for me? Like I always say, you know how to get hold of me. Hey, have a good one, guys. Can't wait to see you in class.